Let's talk about focused antenatal care, FANC, the FANC, that is focused antenatal care. We say that focused antenatal care refers to a minimum number of 4 antenatal visits, each of which has a specific item of client's assessment, education, and care to ensure the prevention or early detection and prompt management of complication. So when we talk about FANC, we try to talk about focused antenatal care. That is a situation a pregnant mother comes to the clinic when she's pregnant at least a minimum of 4 times. Okay, and this is to enable women who are living in area where there is challenges or assessment towards healthcare, so that they can actually make use of that 4 time visit. But however, in the situation the woman has complications or there is a problem that is associated with her pregnancy, the number of antenatal care visits should increase from 4. But at least a woman who is having a normal pregnancy should at least attend 4 times to the health facility for her assessment, care, and education. Okay, this focused antenatal care has a specific item of client's what assessment, education, and care. That is, the client will have to be assessed on a particular thing in each visit. Then the client will be educated on the outcome of the assessment, and care will be provided as well in regards to that assessment and the findings, so that we can prevent, okay, complications from occurring, or even identify the complication earlier enough and also provide care to the woman. And this care can also be in form of referral to a higher facility. So that is why we say it is a minimum number of 4 antenatal care visits, each of which has a specific item of client's assessment. There must be something the client will be assessed on. Then, based on the findings, educate the woman and provide care, so that we can prevent problems or even detect problems and ensure prompt management. So that is what we talk about. Now, when we say specific item of client assessment, the healthcare provider might actually start with identification of pre-existing health problem. Identification of pre-existing health problem. During this time, the healthcare provider will focus on assessment of the existing health problems in the woman, because some persons maybe they are suffering from one condition or the other before they get pregnant. Okay, so identification of this pre-existing health problem through assessments. Okay, then it can be identified. Then education will now be provided. See, you have this condition, you need to do this, you need not to do this, you need to do that. Then care, which if it is a chronic one, needs specialist attention. So when this is done, then we have eventually prevented complication from arising, or we will be in the stage of identifying the complication, because the complication may have started. From that our assessment, we can see, yeah, this problem is about to occur. We can now take prompt management steps. Okay, so that is the essence. Now, in the FANC focus antenatal care, it helps women to maintain normal pregnancies through the following component: through identification of pre-existing health problems. Yeah, like we said, there may be problem existing in the mother, which could be in form of which could be diabetes mellitus, hypertension, epilepsy, and all that. So here you can have HTN, okay, HTN and hypertension. Can have DM, diabetes mellitus, can have epilepsy, okay, which is already existing in the mother. And you know why you need to identify this problem is because if you don't identify this problem, the mother will be in problem, because this pregnancy can actually aggravate these conditions. So, but not limited to that, you can the woman may also be a HIV positive patient, can also be HIV positive patient. Okay, the woman can also have syphilis. The woman may have also syphilis. Okay, all right. So these conditions, if not identified, will worsen. Like in the identification of pre-existing health problem, if the woman is having HIV, that means there's risk of transmission of this HIV to the baby, which is a problem. Or if the woman is having syphilis, this syphilis we know can cross placenta and cause damage to the baby's neurons, because syphilis has what we call primary, secondary, tertiary, and latent phase. If the woman has latent syphilis, it actually means there's high possibility that the woman will have a baby known as syphilitic baby, or the baby may have congenital syphilis, and congenital syphilis is deadly to the baby. Okay, so or if the woman may have hypertension, and this hypertension might worsen and the woman will die from it, or she may have diabetes, or she may have epilepsy. Okay, or she may have anemia. She may already have anemia here. She may already have anemia, and if care is not taken, it will take her life. So that is why we say each of which has a specific item of client assessment. Okay, you measure her BP, you carry out laboratory investigation, VDRL, to rule out syphilis, you measure her BP for hypertension, you check her sugar level for DM, you make history of family history, can provide clues of epilepsy, then you perform HIV and S assessment. Okay, that is what assessment, that is client assessment. From there, you now educate her based on all this. Madam, this syphilis can affect your baby. Look at what we do. We need to commence treatment. Okay. Then hypertension, we need to control your blood sugar. Look at lifestyle modifications you need to adjust to. All right, so that we can save you and save your baby. Then, based on that, education will be provided. Care will now be provided to ensure prevention or early detection and prompt management of what complications. And what is the likely complication from here? We can have syphilitic baby. We can have a baby. The woman can have preeclampsia and hypertension. The woman can have hyperinsulinemia, and it can have large baby, and which can lead to placenta insufficiency. And then epilepsy and this seizure can cause a problem, and the woman can lose pregnancy. HIV can lead to maternal transmission of HIV and S to the baby. Like we said, the woman can actually have this existing health problems such as hypertension, and the assessment is through blood pressure assessment, then syphilis through VDRL assessment, then diabetes mellitus can be screened through the use of glucose tolerance test, okay, or the postprandial test, okay, to rule out diabetes. Then also herpes zoster virus is another form of STI that is dangerous and can actually damage the baby in utero, especially at the third phase of pregnancy, at that trimester of pregnancy. Then anemia and its complication we know can lead to death of the mother, stillbirth, placenta insufficiency, then heart diseases. Heart diseases can be problem because during pregnancy, the heart output, that is the amount of blood that leaves the heart, increases because of the demand of the growing fetus. Then it can be epilepsy, and which has a poor outcome. Tuberculosis, the TB can also cause a problem because TB can cross other structures of the body and can affect the mother's pregnancy outcome. Then STIs like chlamydia, gonorrhea. Here, cover chlamydia, gonorrhea. These conditions do not cross placenta, but once the baby passes through the birth canal, can lead to the baby having ophthalmic pneumotorum. Okay, which is a disease condition whereby the baby's eye is affected. Okay, so that is why we need to identify pre-existing health problems and institute appropriate care. Okay, so that is one of the components of focused antenatal care. Now, also let's look at the next component, which we say is early identification of complications arising during pregnancies. Okay, during this focused antenatal care, it provides opportunities for health worker to talk with the woman and examine the woman too, to dictate possibilities of problems, or to identify problems of pregnancy that might need treatment and close monitoring, such as anemia. This anemia now may be originating because the woman are just taking it in, because once the woman takes in, the demand increases. Okay, so this is as a result of, it's anemia secondary to the pregnancy. Okay, not already existing anemia, maybe due to malaria. Okay, now we say, so as well as anemia, infections. Okay, infections may have originated as well, because maybe due to pregnancy the woman do no longer the immunity is down, and infections might try to occur. Then vaginal bleeding. Okay, vaginal bleeding. So what we're trying to say here, under these complications arising, we'll talk about complications that can come up due to the woman is now pregnant. We'll talk about anemia. Talk about anemia here. We also talk about hypertensive disorders. Hypertensive disorders such as the pregnancy-induced hypertension. Okay. Okay. So the early detection of complications arising during pregnancy can help us achieve identification of anemia. Okay, but there's one thing about this early detection of complications arising during pregnancy. This assessment will always occur, if not in all the whole 4 visits, because hypertension may not be at the first visit, but as the pregnancy progresses, it might arise. So this assessment will continue. That's why blood pressure estimation is carried out in all the visits. So anemia may rise because the pregnancy is still progressing. But the first one, complication that is existing, that's problem that's existing, can be at the first time be screened, and once it's screened, there's no need to assess for them again. Okay, but this hypertension, this hypertension is not a pre-existing one. It is as a result of pregnancy. We'll call it pregnancy-induced hypertension. Okay, then diabetes mellitus, we call this gestational diabetes. Okay, and that is, this diabetes disappears after delivery. Okay, then vaginal bleeding before 24th week of gestation is known as abortion. Okay, and this abortion can be threatening, okay, or inevitable. Okay, so vaginal bleeding can occur because of pregnancy. Okay, which is a result of, can be as a result of threatened abortion or inevitable abortion. Okay, then the same vaginal bleeding that if it occurs after 24th week of gestation can be placenta abruption. Okay, placenta abruption. Okay, and now if it is placenta abruption, the mother is at risk because there's high chances of loss of pregnancy or dying from bleeding. This same so now this vaginal bleeding can arise in pregnancy. We say if it's below 24th week of pregnancy, we suspect either threatened or inevitable abortion. Then if it's from 24th week of gestation, you begin to suspect possible placenta abruption, as placenta detachment, or it can also be placenta previa, whereby the placenta passes the lower segment of the uterus. Then it can also be due to local infections such as candidiasis. Okay, so this helps us to rule it. So that's why I say early detection of complications arising during pregnancy, and once this is identified, prompt measures can be instituted. Okay, another thing is this abnormal fetal position. Abnormal fetal position can also be identified as early as possible, because if the baby is lying in abnormal position, it can bring complication to the mother or to the baby. Because if the mother, or if the baby lies in a breech presentation, the health worker did not carry out adequate assessment of the mother, and you try to augment labor, and if care is not taken, this is a woman that is a multi-gravid, and you use oxytocin carelessly, you can rupture the mother's uterus, and and this rupture is as a result of abnormal fetal position. Now the woman uterus may rupture and she may die out of bleeding. Then to the baby may die maybe due to detachment of the placenta because of the excessive contraction, or due to the interruption of blood supply to the baby because of that induced level using oxytocin. And you know that during contractions, the oxygen and blood to the baby through the placenta is temporarily interrupted. And when this happens, if the fetus is already compromised, the fetus body system might switch over to anaerobic system, and which can lead to baby having neuron damage or even can die in utero. So that's abnormal fetal position is a risk to the mother and to the baby. So therefore, early identification of these complications arising and prompt education of the woman and care can lead to a better pregnancy outcome. Okay, let's look at the next component known as health promotion. That's health promotion and disease prevention. Under this health promotion and disease prevention, we talk about good nutrition and importance of rest. You tell the woman on how to prepare good nutrition, tell the importance to her own health and to the baby's growth and development. Then also now how to prepare good food from locally available food stuffs. Okay, you also educate her on the importance of rest, that she should avoid heavy lifting, especially lifting heavy babies or heavy objects, that it has effect on her and her pregnancy. Then you talk about hygiene and infection preventions. Teach her how to at least wash her hand regularly, cook her foods, especially in food hygiene as well, to prevent fecal-oral transmissions and foodborne intoxications, which can have effect on the pregnancy. Then infection prevention. Okay, you tell her on hand washing and taking of her drugs that are prescribed, especially the routine drugs for her baby. Then education on the risk associated with tobacco use, alcohol, and illicit drug use. Yeah, some of them may be an addict, especially in teens. You need to tell them the risk associated with this. They can also be secondary smokers. So you should avoid this because this has significant effects. Excessive use of alcohol in pregnancy can lead to what is known as fetal alcohol syndrome. Fetal alcohol syndrome, FAS. Okay, so it should avoid it. Kind of the morphology of the baby is somehow, and it's not palatable at all. Also, you educate the woman on postpartum family planning and birth spacing, the importance to her own health, the health of the baby, and to the family. You communicate the importance of family planning to the woman during this health promotion and disease prevention. These particular components can come up in the first visit. Okay, then immunization against tetanus toxoid. You make sure that she completes her tetanus toxoid immunization. Then iron and folate supplementation. You educate her to really take these drugs serious and consume them as and when due. Then treatment of hookworm. Hookworm infections can be treated with all the required drugs. Tell her to take her drugs where applicable. Then intermittent preventive therapy and ITNS. And then this is to treat malaria. Okay, and this starts at 20th week of gestation with once that's quickening. Okay, you teach her to comply to this drug, the SP and all that. Then use nets to prevent mosquito bites. The next is birth preparedness and complication readiness. While under this component, it may not really apply to every woman, but although unless you have foreseen possibility of complication, or the woman is already having the existing problem like diabetes and other hypertension disorders, so that is under control with drugs, you have to discuss with her about a skilled attendant at birth who will deliver for her. Okay, then the place of birth, depending on the complication you already have, or depending on the pregnancy assessment, the outcome you find. Then items needed at birth, if this is necessary even in normal births. Okay, items needed at birth, you need to tell her, not some of them rush in without any items and you may not attend to them. Then money saved for skilled provider, then support person during and after birth, then blood donation should in case this complication requires surgery. Okay, now this focus on dental care visits can occur this way. First visit, at least the woman should visit from 12th to the 16th week. She should come to the facility and get registered. Okay, then the second visit should be within 20 to 24th week of gestation, while the third visit should be around 28 to 32 weeks of pregnancy. Then the last visit, which should be from 36 to 38 week of gestation.